Hi, everyone. Have you ever had a dental emergency and you don't know your benefits? I work at a dental office and I'm still wearing my work clothes. I have this question a lot where people don't know um, their benefits, and that's part of my job to explain their benefits. So I thought I could give you a little bit of information about it just in case you're ever in that situation where you need to see your dentist and you don't know what all those numbers percentages mean. um, they are broken down into, so it's not like a medical policy that just covers, you pay your deductible and the rest is covered. It's covered in percentages. First, 100%, 80%, and 50%. So usually your cleanings and x-rays are covered under 100%. Most jobs offer that policy where it's covered at x-rays, and your two cleanings for the year are covered at this amount, so you don't have to pay anything out of pocket. So if you have dental insurance, make sure you go and see a dentist at least once a year. For your if you do end up needing any treatment after you see the dentist for your yearly exam, uh, if you just need like a filling, it's covered at 80% most of the time, unless your policy is different. These could change depending on your policy, but most of the time is 80%. They could be anywhere between 50 and 80%. But this is what I see from most of the policies. If you end up needing something more in depth, so something, if you need a crown, it is covered at 50% most of the time. So that means if the cost of the crown is 1,500, your portion is going to be 50% of the 1,500. So be prepared. If some policies do cover just 20%, 30%, but then you're you're still getting a write-off on that. The write-off is just the in-network discount. That's another thing to know. So make sure you are also in network with your dental provider, because if you're not in network, you don't get the write-off, which is the in-network discount that your dental office negotiates with the insurance company. There is other things covered under the 80%. Sometimes oral surgery and root canals are covered under 80%, anywhere between 50 and 80. Again, pay attention to your policy. You can get these benefits. You can get a page from your employer. They should, or direct you to the company. There's so many different dental companies that we negotiate with. And just the last thing I want to say is, if you are having a dental emergency, don't and your dentist is closed, you can go to an urgent care. They will see you for an infection if your tooth is infected. And then you can just set up an appointment, follow up with your dentist. You don't have to go to the ER if your dentist is closed, or if it happens to be during the weekend, Saturday, Sunday, or on a Friday. Most dentists are closed on Fridays. That's the other question we get a lot. So we get a lot of calls on Fridays because I actually do work Fridays. So if you guys have any questions, you can message me. Just post them there under my post, and I'll be happy to help. There's last, I just want to mention that according to the American Dental Association, every year there is about 2 million visits to the hospital emergency department just for dental pain. That again reiterates that you don't need to go to the emergency department. All of those can be seen at your dental office. And if you don't have one, most of them have walk-ins. Thank you.